Different people will mark at different rates and to varying levels of severity. Of course, the marking is strictly incidental to the main purpose of dry cupping, which is to lengthen restricted tissues. It's difficult to gauge how an individual will react to the cupping and how they'll mark, with variable factors coming into play such as skin type, body fat, muscle mass. If an individual does mark very quickly, or not sure how they're going to mark, then flash cupping is a fantastic option to gauge their response. So we're going to start with a standard size cup, and we're going to target the erector spinae. So we're coming just lateral to the spine and just above the PSIS, and we're going to pop 2 pumps, so a moderate pressure. And then from there, we're moving quite swiftly. We're going to use a thumb's width in between the cups, and we're going to go 2 pumps. So at this stage, we gauge the reaction. We look at the marking on the skin, and we see the severity there and the coloration. So there's not too much colour in there, so we can pop another cup on at this stage. So third cup, superior to the second cup, thumbs width apart. And then from there we can see the coloration now into the second cup, so it's time to move along. So we release the pressure from the first, and then we continue the pattern lateral to the spine on the left, thumbs width, apply 2 pumps. And now we're just going to repeat and leapfrog these cups, one over the other, until we get to the top. So we're at the top, and we're just going to swap over to the right side of the spine. Again, make sure there's a thumb's width at least in between the cups, so that we haven't got any pinching or pulling on skin. We can see different cup marks have left different levels of severity of marking, but we're moving quite quickly, so we don't need to worry about that. And if the marking wasn't so severe, we could always go around again, but at this stage we've got some good coloration, particularly on the right side, so we're just going to remove the cups now, one by one.